Welcome to Living with Multiple Myeloma. My name is Helena Strauss, and I am a patient just like you, except sometimes I look like this, and sometimes I look like this. About 5 years ago, during the COVID pandemic, I was diagnosed with myeloma. I had 11 vertebral compression fractures, had broken my sternum a couple of times, and multiple rib fractures. And here I am, about 5 years later into treatment. And if you're a caregiver, I want you to know I have also been a caregiver too. I had a sister who died of breast cancer in 2013. I was her primary caregiver. And prior to that, my father died of Parkinson's disease after 25 years of living with Parkinson's. Now, I know that when myeloma comes into your life, whether as a caregiver or as a patient, it is very daunting. For most patients, getting that diagnosis is a shock, even if you've been smoldering. That is the reason I've created this channel. It's for all of us, whether we're living with it or we're caring with somebody who's living with it. This channel is filled with some great stuff to help you out, especially through that very steep learning curve in the very beginning of your diagnosis, where you're just trying to learn the lingo and what your options are and figure out what your future might be like. And in terms of your future, when I was diagnosed, I had 2 different medical professionals say to me, now is the best time to get a blood cancer. Now, I thought they were cuckoo for Cocoa Puffs when they said that, because to me, and probably to you too, there's never really a good time to get a blood cancer. But the fact is, now is the best time to get a blood cancer. There have been so many treatments that have come around just in the last 10 years between bispecifics and CAR T and immunotherapies and things like Darzalex, which is a monoclonal antibody. There's so many options to treat myeloma now. So chances are, if you are a younger patient, you are in otherwise good health, you are going to be living with multiple myeloma for decades to come. And by then, it is very likely that there's going to be a cure. But in the meantime, come by this channel, check out the videos, and especially my newly launched Myeloma Chats, where I talk to other patients about their experience of myeloma, how it's changed their lives, how they handle the side effects of the medications they are on. You know, everybody, while we have a lot in common, everybody's on a slightly different regimen. So there's a lot of information to share. The channel also has a number of guided imagery meditations made specifically for myeloma and its challenges to help you heal and manage with the power of your mind and spirit that go perfectly well alongside everything your medical team will put together for you. But most importantly, I just want to welcome you to the community that none of us wanted to be in, which is living with multiple myeloma. Life goes on. Subscribe now and hit that notification bell so you know when a new video filled with all the good stuff is available.